We're here at Yale New Haven Hospital, and the point is being made about what is being done to Gaza hospitals, all of which are being deliberately destroyed. Incredible scenes of destruction at Gaza hospitals.
No, there's no on and off. It's just on. Once it's plugged in, it's on.
It's just on and off.
On now.
It was a quick drive. I recognize those.
Permanently on.
Okay.
I'll stand next to you there at any time, but don't be afraid to move.
Okay. Saludos. Saludos. Good morning. Buenas. My name is Liza Goldman-Herta. I'm a family physician, a breastfeeding medicine specialist working in Hamden, and a mother of two. I attended Yale University School of Medicine and worked my first job as a primary care provider close by in Fairhaven. Yale New Haven Hospital was where I first scrubbed in to assist with surgeries, witnessed my first birth as a healthcare worker, and helped to admit sick children to the hospital, where I first learned what it is to be a doctor. So I am so proud and honored to have a chance to address people here. I'm a member of Jewish Voice for Peace, New Haven Healthcare Workers for Palestine, Doctors Against Genocide, and the Connecticut Palestine Alliance. As I said, it is a relief and an honor to be able to speak up in support of an immediate and permanent ceasefire in Gaza, and on behalf of healthcare worker heroes working to save lives throughout Gaza and in the occupied territories. It is our duty as healthcare workers to speak up against all war crimes, and especially against the war crimes in Gaza that involve our fellow healthcare workers. I'd like to start by sharing an accounting of a small portion of the health impacts the people of Palestine have experienced in the months since the Hamas terrorist attacks of October 7th. According to the UN and the Gaza Ministry of Health, at least 35,000 Palestinians have been killed in the current war on Gaza. Over 15,000 of them children. These numbers are very accurate, more accurate than almost any numbers we have from events such as these. And they likely represent an undercount given the thousands still uncounted buried under the rubble. There are published peer-reviewed scientific articles carefully examining the plausibility of this accounting and supporting the veracity of these features, of these figures. We know that people are being mass murdered. I want to pause and focus on the children as a maternal and child health specialist. So deadly is this war for children that it had far outpaced by 6 months the deaths of all children in all armed conflict worldwide for the 4 years preceding. This is not a regular war against children. A war on children is a war on our humanity. Yes.
In addition, the WHO estimates that 90% of children under the age of 2, I'm referencing babies, who I see on the daily in my practice, face severe food poverty. So as I go through my day here in Hamden, Connecticut, I see mothers and babies, and I imagine mothers and babies in Gaza. Hundreds of thousands in Gaza are at imminent risk of starvation and death from preventable causes. When we face situations like these, we're often told to look to heroes, people who run into burning buildings, teachers. There are heroes all around us. A hero can be someone larger than life, but a hero can be anyone, including you and me. In Gaza, I also wanted to share that our healthcare worker colleague heroes work in hospitals in a place where almost every single hospital, 35 or so hospitals in Gaza, has been multiple times destroyed, bombed, shelled, and healthcare workers, so my counterparts over there, detained, tortured, executed. For those of us who've been keeping track of our colleagues and counterparts, it's been a nightmare that we find hard to believe. So among these healthcare workers are paramedics, like the two paramedics who went in an ambulance to rescue Hind Rajab. They include, since we're at Yale School of Medicine, where a lot of the leadership are nephrologists. They include, if you're talking about doctors, they include pediatricians, they include internal medicine doctors, they include pharmacists, they include just about any healthcare worker you can think of. We've seen at a hospital, like a large teaching hospital such as Yale New Haven Hospital, an equivalent might be Al-Shifa, a hospital where we think that several mass murders have occurred. And so this is what our colleagues from all over the world are as healthcare workers in solidarity with Palestine are doing now. They are imagining every way possible to stand in solidarity with their colleagues. They are considering going to Gaza. Some have been to Gaza. They are attempting to send aid to Gaza. All of these efforts I support. I think all of us should reach and think of ways that we can support our counterparts, our colleagues, and humanitarian workers in Gaza. But everyone always comes back to the overwhelming conclusion: without a ceasefire, healthcare workers cannot do their work. Without safe hospitals, lives cannot be saved. So I ask you to please, whether you're a healthcare worker, whether you're a patient or someone who at some point could receive health care, to stand up in this situation, because impunity in this situation makes us all less safe. I wanted to speak today also as an Ashkenazi Jewish American. I'm also Puerto Rican. I have relatives who survived the Holocaust. My father taught me that to be Jewish is to side with the oppressed. I deeply reject anyone claiming to represent me as a Jewish person who does not act in solidarity with the oppressed. I reject the idea that peace is only for one group of people. Peace and justice benefit all. For this and so many other reasons, please work for ceasefire. I'm also a family physician, and I'll go a little bit off script here. A lot of our work, a lot of our most powerful work with our patients involves their own journey to figure out what they could do to be most healthy. So it applies in this situation, where I feel each one of us is a lot more powerful than we realize. This moment requires us to do an inventory. In what ways am I related to this atrocity that is occurring? What power do I have to affect what's going on? Sometimes it seems daunting, something so enormous, but sometimes you could just start with one simple step. You can call your representative. I definitely recommend joining a group, so joining with others. On day 109 of what many are calling this genocide, I was following a Palestinian journalist who said, "This is day 109 of the genocide. I am still alive," because that's how she tends to open. This is Pizan Auda, for those of you who follow her. And for some reason, that number, 109, triggered something in me. And I said, she's survived 109 days of genocide. I can do 109 actions to speak out against this.
Wow.
And so I'm happy to say that I use that as motivation. And I'm happy to share with anyone if they're looking for ideas of things, small things you can do that gradually build to, potentially a big change. I'd just like to end by saying, ceasefire now, let Gaza live, and free Palestine.
When I think of Gaza's plight, its children haunt me day or night. All the children who are crying, all the children who are dying, and the things they see that no one should have to bear, happening there, so filled with fear, they're silent. Children should be having fun, safe place to play, safe place to run, wholesome food and good clean water, safe for parents, son and daughter. And we must hope, and together we must strive, keep them alive, not filled with fear and silent. Our country can't ignore all the horrors of this war. Let's take more actions for peace. Ceasefire actions must increase. We must stop this terrible tragedy. No complacency. We must not be silent. We need a permanent ceasefire. Thank you for singing. That sounded great.